Hello, I am Dr. Yong-soo Choi, a neurosurgeon at Wooridul Spine Hospital. Today, I would like to talk about what we call the kissing spine. When you hear the term kissing spine, it may sound like something good or something bad. Many people get that kind of mixed feeling. The original medical name for kissing spine is Bostrup's disease. It was discovered by Dr. Bostrup, and the condition was named after him. Because the vertebrae look as if they are kissing each other, it earned the nickname kissing spine. This is a model of the human lumbar spine. This is the front, and this is the back. As you can see here, the lumbar vertebrae look like this. In the front, we have the vertebral body. In the back, there are bony structures called spinous processes lined up in a row. Between these spinous processes, there is a ligament called the interspinous ligament. What does this ligament do? When you bend forward, the space between the spinous processes opens. When you bend backward, that space narrows. This ligament supports and stabilizes the motion of the lumbar spine. However, this ligament can become damaged. Sometimes it is damaged secondarily due to spinal stenosis. Other times, the ligament itself is primarily injured. When this ligament becomes damaged, it cannot function properly. It does not open well when bending forward, and it does not provide enough support when bending backward. As the function weakens, the space between the spinous processes becomes narrower, and the upper and lower spinous processes start to hit each other. This contact resembles a kissing motion, which is why we call it kissing spine. So what happens when these bones collide? First, pain develops. Naturally, bone-on-bone contact hurts. You also lose range of motion. You may not be able to straighten your back fully or bend properly. As the condition progresses, the lower back does not move well at all. Because of the pain, even standing upright becomes difficult. People end up supporting themselves while standing or walking with a limp. Various issues begin to appear. When the kissing spine becomes problematic, stepwise treatment is needed. The first option is an injection to reduce inflammation between the spinous processes. However, this only works if there is still some healthy ligament remaining, because the injection reduces inflammation and helps the remaining ligament function better. The second option is for cases where the ligament is too damaged to function. In such cases, the ligament needs to be replaced. This is done with artificial ligament reconstruction. This model shows what the spine looks like after the procedure. You can see the artificial ligament placed between the spinous processes. There are two components to this ligament. One is the longitudinal part that connects vertically, and the other is the transverse part that holds horizontally. By securing the ligament in this space, we create room between the spinous processes and prevent the bones from colliding. It also supports proper spinal motion when bending forward or backward. Today, we learned about the kissing spine. This condition causes pain because the bones collide. The good news is that this pain can be treated. Still, the most important thing is prevention. Maintaining good posture and exercising regularly are essential to avoid developing kissing spine in the first place.